using the Oral-B iO electric toothbrush for a few weeks now and absolutely love it. But what does a professional dentist think about it?
We're literally like floored. We love it. We're obsessed with it.
I sat down with Dr. Diora Kashat and her hygienist, Katie, to chat more about the Oral-B iO electric toothbrush.
So this is the Oral-B iO. All right. So you're going to go ahead and turn it on. All right. First of all, you can hear that it's relatively quiet. All right. So when you're brushing, you see how you have that green light? That green light is the perfect amount of pressure when you're using it. Okay. If you press too hard, can you see the red?
Yeah.
That means you are pressing way too hard. All right. So you want that nice green light. Second of all, it does have a timer down here as well. So this will time you for 2 minutes completely, but it also has that 30-second timer. I don't know if you just caught that, but it actually kind of does like a little buzz or a pulsate every 30 seconds. You're going to angle it right along the gum line, nice amount of pressure, and you're just going to slowly go in one quadrant for 30 seconds until the brush tells you to switch. 30 seconds. I don't know if you caught that.
Yeah.
But then you're going to switch to your other area.
It makes it super foolproof. You know, you're doing exactly what we want you to do, and you don't even think about it. You just put the brush on the teeth. That's really it.
So that's basically taking off your tips for pressure and
That's literally it. This brush does everything we want you to do, essentially.
As part of the Force for Good initiative, Oral-B is partnering with dental professionals across the United States to give away a total of 500 iO brushes to people in need, 5 of which are patients of Dr. Kashat's.
You know, we have one patient that's a frontline worker. She works at the front desk at an OBGYN office, so she was there all of COVID. Another patient actually works for a fast food restaurant and got COVID, was hospitalized, and now back on the mends, trying to get their life back in order. Another patient, her doctor's offices shut down during COVID. She went through a really, really tough time with her health, ended up actually having a heart attack coming back from COVID, and then now is doing a lot better. So it's just patients that, you know, have been affected by COVID, whether it's their health was affected or their job was affected. The Oral-B initiative was kind of, you know, a cool opportunity that came across to kind of get our name out there, you know, show people that we care about the oral hygiene part of things, the education part of things, more than just fixing what's broken, and more of the preventative side of things, kind of. I want to celebrate that moment with them, take a picture with them, you know. And
after I brush with the Oral-B iO, my teeth literally feel like I came from the dentist. They're so smooth, they feel so clean. I don't think I could ever use another toothbrush. You can learn more about the Oral-B iO toothbrush and check out Dr. Kashat's tips on how to wow your dentist on your next visit at heyitsjanet.com.